Stomach pain is one of the most common health problems we face. The abdomen contains several vital organs like the stomach, intestines, and pancreas. And when any of these organs get inflamed or aggravated, it leads to stomach pain. Stomach pain can be so uncomfortable that it may interrupt your daily activities and make you miss work or school. Fortunately, there are natural remedies available to relieve this pain without taking any medications. In today's video, we will share 10 of the best natural remedies for stomach pain relief that you need to try if you suffer from frequent stomach aches. Let's start. Number 1. Peppermint. When you have an upset stomach, the muscles in your gut may contract more frequently, which can lead to stomach cramps. This is where peppermint comes into play. A study published in the Journal of Gastroenterology and Hepatology found that peppermint oil is effective in relieving symptoms such as abdominal pain, bloating, indigestion, and gas. This oil relaxes the smooth muscles in your digestive tract and relieves stomach pain by improving digestion. You can drink peppermint tea or use peppermint oil topically for this purpose. To make peppermint tea, add a pinch of dried peppermint leaves or a few fresh mint leaves to boiling water. Let it steep for 5 to 10 minutes. Then strain and drink. You can also add honey for added benefits. For topical application, dilute peppermint oil with a carrier oil like coconut oil and rub it gently on your abdomen in a circular motion. No. 2. Ginger. Ginger is another herb that has been used for centuries to treat nausea and stomach pain. Gingerols. Ginger's active compounds have anti-inflammatory properties that help soothe the stomach lining and reduce inflammation. According to a study published in the journal Evidence-Based Complementary and Alternative Medicine, ginger powder supplements are safe and effective in relieving nausea and vomiting after surgery. You can consume ginger in various forms, including raw, powdered, tea, or juice. If you want to take ginger powder, start with a small dose of 500 milligrams per day and gradually increase it to 1.5 grams per day. You can drink ginger tea by steeping ginger slices in hot water for 10 to 15 minutes. Or you can consume ginger juice by extracting it from the root vegetable and diluting it with water. No. 3. Apple cider vinegar. Apple cider vinegar contains acetic acid, which helps improve digestion and reduce stomach pain. A study published in the Journal of Functional Foods found that consuming apple cider vinegar supplements reduced bloating and gastrointestinal discomfort in adults with functional dyspepsia, a common condition causing persistent stomach pain and bloating. Start by drinking 1 tablespoon of apple cider vinegar diluted in a glass of water before each meal. You may gradually increase the amount to 3 tablespoons per day. However, if you have any underlying digestive conditions, consult your doctor before consuming apple cider vinegar. 4. Fennel seeds. Fennel seeds contain a compound called anethole, which has antispasmodic properties that relax the smooth muscles in your digestive tract. These seeds also have anti-inflammatory agents that reduce inflammation in your stomach. A study published in the Journal of Pharmacy and Pharmacology found that fennel extracts effectively reduce gastric contractions, which can cause stomach pain. You can eat fennel seeds raw or as a spice in your meals. To do this, lightly toast the seeds in a dry pan until they become fragrant. Then grind them into a powder and sprinkle over your food. Alternatively, you can brew fennel tea by steeping fennel seeds in boiling water for 10 minutes. Strain the mixture and drink. Now 5. Chamomile. Chamomile is known for its relaxing properties. But did you know that it can also soothe your stomach? A randomized controlled trial published in the Journal of Clinical Pharmacy Therapeutics found that chamomile extract significantly reduced the severity of functional dyspepsia symptoms, including stomach pain, bloating, and indigestion. This herb relaxes the smooth muscles in your digestive tract and reduces inflammation, relieving stomach pain. You can drink chamomile tea for this purpose. Steep dried chamomile flowers in hot water for 10 to 15 minutes. Strain and drink. You may also add a little honey for better taste and additional health benefits. Number 6. Chia seeds. Chia seeds are packed with fiber, which helps to keep your digestive system healthy and prevent constipation. A study published in the journal Nutrients found that chia seeds improved bowel movement frequency and stool quality in constipated adults. Consuming enough fiber through chia seeds can prevent and alleviate stomach pain caused by constipation. You can consume chia seeds soaked in water for 20 to 30 minutes to make chia pudding. Mix the seeds with milk, yogurt, or fruits. Chia seeds also absorb toxins in your body and eliminate them from your system, reducing inflammation and relieving stomach pain. Number 7. Banana. Bananas contain a compound called which is a type of sugar alcohol that helps regulate intestinal muscle contractions and relieve diarrhea-associated stomach pain. A study published in the journal Nutrients found that inositol-enriched foods such as bananas reduced abdominal pain and improved stool quality in children with irritable bowel syndrome. In addition, bananas contain pectin, a soluble fiber that absorbs water and adds bulk to your stool, making it easier to pass and reducing constipation-related stomach pain. Number 8. Spinach. Spinach and other dark green leafy vegetables are rich in chlorophyll, a compound that aids in detoxification. Chlorophyll helps eliminate toxins from your body, reducing inflammation in your digestive tract and relieving stomach pain. Additionally, spinach contains a variety of You can include spinach in your diet by adding it to salads, smoothies, or cooking it as a side dish. However, if you have kidney problems, consult your healthcare provider before eating large amounts of spinach, as it contains high levels of oxalates, which can worsen kidney stones. Number 9. Yogurt. Yogurt is a probiotic-rich dairy item that helps maintain a healthy balance of bacteria in your gut. A study published in the British Journal of Nutrition found that consuming probiotic-enriched yogurt improved symptoms of irritable bowel syndrome, including stomach pain, bloating, and The probiotics in yogurt help improve digestion and reduce inflammation in your digestive tract, relieving stomach pain. Choose plain unsweetened yogurt and consume it regularly for maximum benefits. Number 10. Papaya. Papayas contain a powerful enzyme called papain, which aids digestion and reduces stomach pain. This enzyme breaks down protein in your digestive tract and eases the passage of food, preventing protein-related stomach discomfort. Papaya also contains soluble fiber, which helps regulate bowel movements and prevents constipation. Additionally, the vitamins and minerals in papaya support overall gut health, strengthening the digestive system and reducing the risk of stomach pain and other digestive issues. Eating papaya regularly can help prevent and alleviate stomach pain associated with protein, digestion, and constipation. When dealing with stomach pain, it's essential to identify and avoid your triggers. Common triggers include stress, certain foods and beverages, and underlying medical conditions. Managing these triggers is crucial for effectively treating stomach pain. Stress can exacerbate stomach pain, so practicing stress reduction techniques such as yoga, meditation, deep breathing exercises, or spending time in nature can be helpful. Keeping a food diary can help you identify trigger foods that may be contributing to your stomach pain. Common trigger foods include spicy or acidic foods, caffeine, dairy products, processed foods, and artificial sweeteners. It's important to note that everyone has different triggers, so it's essential to keep track of what you eat and how it affects your stomach. Certain beverages can also trigger stomach pain. Alcohol, carbonated drinks, and hot beverages can all contribute to discomfort. It's best to avoid these drinks or consume them in moderation. Some medical conditions can also trigger stomach pain, such as gastrointestinal disorders, infections, or food allergies. It's important to consult a healthcare professional to diagnose and manage these conditions effectively. By identifying and avoiding your triggers, you can significantly reduce the frequency and severity of stomach pain. Remember to prioritize your overall health and well-being, and don't hesitate to seek medical attention when needed. Thank you for watching. Do not forget to subscribe for more informative content, and like this video for more health and wellness tips. Stay healthy and take care.